Okay, good morning all in Netherlands. Greetings from the Gambia, where I am right now. I wish I could be with you in person, but unfortunately I couldn't join you, but be rest assured that I'm there in spirit with you to celebrate 50 years of IDA. First of all, a big congratulations to the IDA family, both past and present, and anyone who has contributed to making IDA what it is today. 50 years of engagement in global health is definitely noteworthy to celebrate. There are great milestones to think of, there are reflections to make, and thinking about thoughts of the future as well. When I was invited to talk about IDA for their 50th year anniversary, my first thought was, wow, what can I say? 50 years is a long time, and there has been so many things that has happened over the years. Then I realized that actually, whenever I think of IDA, I tend to link it with global health activities, key milestones that has happened over the years. And therefore, I can reflect back from IDA over the years, linking them to these key milestones that everybody know has impacted us over the years. So the first one I thought of was primary health care. I'm not sure how many in the audience still remember the good old days of primary health care around the 1970s, but it was a very important milestone because that was when people started talking about providing services, delivering services at the community level. And I was very actually impressed to realize when I was reading the milestones of IDA that they started that work supporting missionaries in health centers in parts of Africa before the Alma Ata Declaration. So IDA was there at the forefront, and I believe the primary healthcare activities actually gave them a bigger platform to operate on. So that was one of the key achievements of IDA over the years. Then we had the other milestone that was linked to the provision of essential medicines. WHO started talking about essential generic medicines to be able to support countries to use their budget more wisely as compared to spending more money on branded products. But one of the key challenges I remember there as well was that a lot of negative perception where essential generic medicines were actually equated with poor quality of medicines because they were lower in cost. IDA was once again on the forefront, and as time went on, I was chief pharmacist in the Gambia at that period in time. And I recall one of the key things about IDA was the fact that IDA helped countries to equate essential medicines with quality. So IDA brought in that trust for countries to be able to know that even if you don't have good quality facilities, IDA can give you that guarantee with the products. So that was also very important and a critical milestone. Then I moved over to Geneva, or before I even moved over to Geneva, the whole issue of HIV came. And one of the key challenges was how could countries in lower middle income countries actually access ARVs because they were very expensive at that point in time. And even with the generic ARVs, it was still challenging to access them. IDA was one of the first wholesalers I remembered delivering ARVs to Gambia, my country. So that was also very important. They were there. And even when I left Gambia and joined the Global Fund, I recall they were one of the first organizations that came to meet me in Geneva to discuss in terms of what can they do to support the Global Fund in providing access to the ARVs to countries. So IDA, I still recall, was always in the forefront. IDA as a wholesaler is also very much engaged as a procurement agent. And they were one of the first ones that we are supporting public procurement, which everybody always see as a maze of challenges. It was always challenging to be involved in public procurement. And therefore, IDA was one of those who were engaged, supporting countries in public procurement, providing the products when they need it as a wholesaler. And they actually helped redefine the whole concept of procurement service agents within this period. But my favorite recollection of IDA is not linked to any of these critical milestones. It's actually linked to my personal experience when I was chief pharmacist. I went for a meeting in Netherlands. I can't recall what meeting it was, but one of the highlights was a visit to IDA warehouse. And when we went to that warehouse. I was like, wow. You know, when you meet someone and you are so impressed by that person, and your first thought is, when I grow up, I want to be like that person. My thoughts were actually, I hope I will be able to get a similar warehouse like IDA in my country, Gambia, because it was really impressive. So my reflections on IDA is always been at the forefront, being a pioneer on things and getting things done. Also think about what next for IDA. 50 years is a long time to be there, and they have been there and managing things successfully. So at this point in time, I wish you good celebration, and I'm honored to be part of this celebration.